I get clients all the time that are always asking, what do I do to help my horse stay in, and when do I know he needs another treatment, or what can I do to help him? Well, one of the main things that exists are spinal assessments. And by that, it comes by a variety of things. What I'm mainly talking about are belly lifts, bum tucks, backups, and the like. They're all spinal assessments. Okay, so one note of caution. If you don't know your horse, or your horse isn't used to these sort of assessments, don't just blindly come up here and start poking on them, because it can be extremely painful if their spine's out or you're activating anything that's causing the spine to be out, which is an organ. It can be anything from an ovary issue in mares to a impinged nerve up here that's going to excite some reactivity. So if I utilize this as sort of the spine, this is flexion, this is extension. If it's blocked in any of those positions, left, right, rotation, it's going to be blocked in flexion or extension. So what we're going to be looking for is flexion, but where it's out is most important. So, number one, belly lifts. Belly lifts is really a better name for it, is mostly a thoracic lift. So what we're looking for is the thoracic spine from T18 at least to about T5. Does it flex and come up, just like lightness on the forehand? So the way you do that is you apply pressure medially, or dead center in the middle, up and forward simultaneously. And as your hand comes forward, right underneath the withers, right behind the elbow, that pressure then goes up. So the vector would look like this. So let's look at this mare. This mare has quite a few things showing up, so I don't think we will see a very A-grade belly lift. It should be effortless, easily, and lifting. It should be effortless lifting, like this. Okay, so let's see. You start about right here, and you apply pressure, and right away I'm not getting really any lift. A little right there. Nothing in this area, and agitation, and not much. So that would be a occluded problem belly lift, okay? Let's move back. Now, I know this mare, on most horses that I begin, I already know there's going to be a problem, so I don't even bother with this, but at the end I utilize it as a diagnostic assessment tool. Bum tucks. We're looking for flexion from, well, really all the way from about T11 all the way into the sacroiliac junction. And what you do is you have this whole little area right in the gluteal pouch here, and you scratch it like a bad mosquito bite, like this. And so it's coming up fairly okay. I would say that's reasonable. I'm seeing from this, though, she's going to grab right there. So I'm finding something right there. These are highly diagnostic. What you want to know in the beginning is, does this work or doesn't it? Is it coming up with easy effort, or do I have to dig in? That's a bum tuck. Backups. Backups are particularly helpful because they really assess the SI joint, the sacroiliac junction. Can it flex? Can the rear end sit down like in a backup or a stop, and that sort of thing, or multiple collections? So here we go. This one is just lateral of the tail set, right off the semitendinitis muscle. This one's actually push in with your thumbs hard, and that actually tells me that her sacroiliac is not in bad shape. Let's do that again. Kind of deflate about 1.5 inches, 2 inches off the lateral tail set, not up here, not down here, right at the tail set. On some horses, it's going to be further. Just get close, push in with your thumb. That's pretty good. Doesn't mean it's perfect. If she walks off, that could be a problem. The last one I'd like to show you is, I call it an oblique tickle. It's really checking the abdominals and the oblique muscles that run here. Now, if you have some large intestine issues, and if you can see on the camera this line right there, you know that you have some obstruction right there. So if I palpate that, here it doesn't look bad, here it doesn't look bad, right there it is, right at this pelvic flexor. There's a real tight area going on. She's got some sort of nutritional thing I gotta look at. If I tickle that right there, what I'm looking for is, this is really the main component of collection. It's the abdominal core, Pilates muscle, that's holding the spine up. That's a secret to us. That's a secret to our back problems. It's a secret to theirs. The top line helps, but the top line is supportive. This is the driver. So get in here and just tickle them. And it's coming up okay, but can you tell the mare is not too happy? Obviously, you get some pictures like that. So we're going to revisit this mare in a little bit and see what changes we can find.